Prescribing from the Anticipatory Medicine Formulary for patients nearing end of life. The Anticipatory Medicines Formulary has been set up so that it contains the main controlled and non-controlled medicines that are required for patients nearing end of life who are being cared for in the community. Please ensure you are using this formulary if prescribing anticipatory medicines. The quantities have been pre-populated with words and figures for controlled drugs. These can be amended if deemed appropriate. For non-controlled drugs, suggested quantities have been included in the formulary. We are now going to view a video on how to prescribe from this formulary. Whilst in a patient record, click on the red TTO button on the toolbar. The Select Drug or Appliance dialog box opens. To the left of the screen, it auto-populates to the pharmacy TTO stock list. We're going to select the Anticipatory Medicines Formulary. The drugs to the right of the screen change to show these medications in the Anticipatory Medicines Formulary. Select the drug from the list. For this example, I'm going to select the control drug diamorphine, 5 mg powder. Click on it to select it and you will click OK. Do not double click on a drug as this has been known to cause prescribing errors. So highlight and click OK. The patient-specific warnings for that medication are displayed. Read the warnings. When you're happy to proceed, click on the Proceed button. The Prescribe to Take Out dialog box opens. Always check the drug field to check that you have selected the correct product before entering the dose details. I'll now complete the dose field. This is a training example. Note well, a dose must be specified for legal reasons for controlled drugs. As this is a controlled drug, the required quantity and duration tick box defaults to being ticked for this medication. Because it's a controlled drug, we have extra fields to complete. The quantity fields are already auto-populated from your selection. In the first admin field, I'll select today's date. Supply until field. If I type in 6 and D, press my tab key. I'm wanting this to be a 7-day supply, so it adds that into them details there. This includes today as day 1. Notice that the course length is defaults or auto-populates to 7 days. In the reason field, type the reason for giving the medication. Continuation field, this defaults to GP to review. There are other options available. To prescribe further medication, click on OK and another. If it was only the medication that you were prescribing, you would have clicked on the OK button. For this exercise, for this video, I will click on OK and another, as I am going to go on to prescribe a non-controlled drug from this same formulary. The question box opens. Do you want to print the controlled TTO drug form when the patient record is saved? I'm going to select yes. And information box opens to inform you that the TTO form will be printed when the patient record is saved. So I shall click OK. Again, the select drug or appliance dialog box open. The formulary has again defaulted to pharmacy TTO stock list. I want to prescribe from the Anticipatory Medicines Formulary, so I shall click on that to select it. And then the medicines in the formulary are showing on to the right hand side of the screen. I'm going to now prescribe a non-controlled drug. Remember, highlight and click OK. Patient-specific warnings open for this medication. Read, and when you're happy to proceed, click on the Proceed button. Prescribe to take out dialog box opens. Remember again to check the drug field to check that you have selected the correct product before completing the dose field. Again, I will complete the dose field for this training exercise. As this is not a control drug, the required quantity and duration tick box is not selected, and there is no requirement to complete the extra fields seen when prescribing the controlled drug. Type in the reason for the medication. The continuation field again defaults to GP to review. Other options are available. I shall keep it at GP to review. I'm not going to prescribe any further medication, so I'm just going to click on the OK button. We're taken back to the medication chart node with both the drugs we have just prescribed showing in this node to the right hand side under the TTO tab. Now we need to save this medication into the patient's record. So the Save button in the toolbar, click on there. The question box opens. It's asking you to decide whether you want to move the patient onto the pharmacy stage of the process or keep it at the doctor stage. For this training video, I shall click No. I shall keep it at the doctor stage. It may be that I still need to complete the questionnaire. Click No. The information box opens. The TTO medication form has been printed. Click OK. And then we are taken out of the patient's record. The information you type into the dose field will be different for each patient. The community prescription chart that accompanies the anticipatory medicines will have the full dosing details on it for the community nurses to administer from. Always speak to your pharmacist for advice if you're not sure.